Good morning. I'm Dr. John Murphy, and I've been a practicing podiatrist here in Corvallis for 25 years. My practice consists of sports medicine, office-based and hospital-based surgery, as well as treating quite a few diabetics and athletes.
Doctor, I've got some corns on both of my feet. Are there any products or things I can get over the counter to help me avoid surgery?
It's a good question, Mike. Firstly, a corn or a callus defines a buildup of dead skin either at a point of pressure or friction. Typically, we'll see this in deformities like a hammer toe, where the digit will actually cock up and the patient will develop a painful buildup of dead skin on the top side of the toe, the tip side of the toe, or sometimes in the ball of the foot from pressure. Pads work well to offload these pressure points. Typically, the pads are either going to be made of gel or fabric, such as felt. The pads can come as sleeves or sometimes as buttress pads. Additionally, you might consider a metatarsal pad placed in the ball of the foot to help offload the pressure point. And I think if you stay consistent with that, most patients can avoid surgery by using a good quality pad.
The middle of my feet hurt when I step down, especially when I get up in the morning. What could be the issue there?
It could be one of the more common problems we see in my practice is a first step pain that is typically referred to as plantar fasciitis. So the bottom of the foot has a large, broad, dense tendon that runs from the heel to the toes, and in the non-weight-bearing position, sleep, resting, and etc., the foot will flex and the tendon, which is bowstring shaped, will actually tighten up. So rest will make this problem worse. So first step pain, typically in the heel and the arch, is what is typically referred to as plantar fasciitis. We have different types of treatments for plantar fasciitis. Stretching seems to be quite helpful for most people. Good supportive shoes, orthotic inserts. Night splints have grown very popular in treating plantar fasciitis. This is an example of a night splint called a Strasbourg sock that places the foot in a more neutral position, and then at night you can adjust the splint. That will prevent your foot from flexing down, which will minimize some of the first step pain in the morning.
My primary care doctor suggested I get these special socks for circulation that go around my feet, ankle, calf area. Can you tell me more about this and why I would need them?
Primary care is probably referring to what we call compression socks. When the circulation comes down into the leg via the arteries, the return system is with the veins and the lymphatics. If the venous or vein system isn't efficient, and that is a very common problem, then the blood will pool in the lower extremity of the leg, the ankle, and the foot. Wearing a compression sock is a device that would typically go to at least below knee level. There are varying amounts of compression with the socks. Some are 8-15, upwards of 20-30. Some are prescription, some are over the counter. All of the devices are designed to help facilitate movement of the blood from the foot and ankle back up to the heart.
And then I'm also a runner, and we here in the running area with circulation and training and things like that, that these socks are effective as well. Can you speak to that part as well?
So the running sock, typically referred to as a compression sleeve, runners are often interested in improving their circulation both before and during the run, and then minimizing some of the lactic acid buildup. Runners' cramps after running typically is due to a buildup of what we call lactic acid in the muscle, and compression sleeves have been shown to reduce some of that buildup. So the runner is probably using a device that looks more like a sleeve and less like a sock.
I hear and I see about all these extra shoe inserts and arch supports and things. I already have some in my shoes. Why do I need these, and is there a certain kind that would help me better?
Well, we see quite a few structural problems that benefit from arch supports, and the type of support is typically dictated by the type of problem. For example, someone that's flat-footed, that's a structural problem where the foot flattens or pronates, and that can shift the foot, ankle, and knee as well as the hip out of alignment. So in that patient, we are looking for perhaps a more rigid orthotic insert to provide a more neutral position. Another example would be a geriatric patient who has lost some of the fat cushion in the ball of the foot, which is a natural progression of aging. For that particular patient, we may place them in a device that would be more sponge-like or gel-like and less structured. So really the type of orthotic appliance would be dictated by the type of problem.
A lot of people get itching between their toes, on the bottom of their feet, and then you hear about fungus, things like that. Is that what we call athlete's foot? And what should I do about that? Or what could I recommend to people to deal with that?
So the foot contains a certain flora, a normal amount of organisms, which would include bacteria and fungal organisms. And in the foot, fungus loves dark, moist environment. So problems typically develop where either the population count of fungal organisms goes up or the resistance goes down. For example, we see percentage-wise more fungal infections in people that have sweaty feet because the fungus will thrive in that dark, moist environment. They can live in the web spaces, and you can develop a problem that's commonly referred to as athlete's foot, although we see as many people who are not athletes that get this problem. It can manifest as a dry, scaly dermatitis in the soles of the feet, but it can also create a very moist, macerated infection between the toes. The key to prevention is to make sure that you reduce the amount of moisture that is present. You can use absorbent socks, you can use antifungal powders, and there's also a number of antifungal agents that can be used for skin and toenail infections.
So I heard around pool and locker room settings, this is particularly important, that people often wear slides and flip-flops. Is that more of a preventative thing than anything?
I think using a flip-flop, a slide, an aqua sock around pool areas, around athletic clubs, around locker rooms is another good way to prevent the infection so that you're not acquiring what somebody else may have left behind. So it's a terrific idea.
And speaking of runners and athletes and whatnot, I hear a lot about what we call Morton's toe. Can you talk a little bit about that and how that impacts the runner, and if they need any inserts or special things for that?
So Morton was a fella who did a lot of foot research, and he's described two problems in the literature, very common problems. One is a situation where the second toe is a full knuckle longer than the big toe, and that can be a potential problem for shoes just because of the way shoes are cut and tapered. So often the Morton's toe, because it's so long, buckles in the shoe, and the patient can have pain either on the top side of the toe or the tip of the toe. Morton also described a problem between the toes, and it's a nerve-based problem called a Morton's neuroma. And that's a benign inflammation of the nerve, where almost similar to having a sciatica in the back, where the disc is the problem, but patients complain about the radiating pains down their hip, their back, the posterior thigh. We see the same thing in the foot. The problem tends to be in the web space of the foot, but the chief complaint from the patient is a very sudden, sharp pain into the digits, and that's caused by compression of that abnormal nerve.
I often see people wearing metatarsal sole pads or even over-the-counter inserts to help in this area. Does that actually help?
Biomechanical approaches for treating Morton's neuroma would be the best first choice, and what you're after there is you want to minimize some of the pressure on the nerve, and also you want to press up on the bottom of the foot either with a good metatarsal pad or an orthotic that has what we call a metatarsal dome. What happens there, Mike, is that the bones get pushed up and spread, and by spreading you actually serve to decompress the nerve and to address the symptoms.
MyFootSupplies is a new foot care product line we've had here at Timber Hill Athletic Club since last fall. Some of the products that we have, Dr. Murphy talked about today in his foot care session. We have a wide variety of products for all your foot care needs, from blister pads, shin splint sleeves, toe sleeves, and foot creams. we have everything you'll need for your foot care needs.